Hey, today marks 4 years since Kentucky's first reported COVID-19 case.
Jim Stratman is joining us in the studio with how doctors are still tackling the long-term effects, Jim, for a lot of people.
Yeah, that's right. It is important to note that COVID-19 is not gone yet. We just have more tools to handle the virus that's led to nearly 19,000 deaths across the Commonwealth. For some, complications from some of those very first infections are still having lasting impacts 4 years later. Doctors at Norton Healthcare tell me they see plenty of patients who are experiencing long-haul COVID-19. They say that once COVID gets into your system, it can lodge itself in the cells all over your body. Those could be in your head, it could be in your gut, it could be in your lungs. And if you aren't vaccinated or you didn't get any one of the antivirals that are now available, you're at increased risk of having symptoms related to that COVID infection months or even years later. I spoke with Brittany McAndrew, who is a speech-language pathologist out at Norton Healthcare. She works with patients who are experiencing brain fog from long-haul COVID.
We teach patients attention strategies, memory strategies. We then use exercises to help practice using the strategies effectively. Not everybody returns to what they knew as normal, but a lot of patients can regain the skills and the functions to return to a normal lifestyle.
McAndrew says her patients range from having caught COVID a few weeks ago to now having caught it up to 3 years ago. And doctors at Norton Healthcare say the best way to avoid getting long-haul COVID is to test on the third day of your symptoms. Go to the doctor and see about getting an antiviral if you are sick, and make sure you are up to date on your COVID vaccines. Eric, Grace.
Also, Jim, the focus on COVID here, again, 4 years later, not entirely gone. The CDC did just release some new guidelines. Yeah,
that's right. So we remember kind of those guidelines when they came out, lots of staying at home, isolating, wearing your mask. Things are a little bit more lax now. So if you've been in isolation, you have a fever, you've been fever-free for 24 hours, you can go ahead and get out of isolation as long as your other symptoms are improving. And also, wearing a mask is still recommended for 5 days after your infection.
All right, Jim, thank you so much. We want to give people that info if you do want to find anything more on COVID vaccinations and all the stuff Jim was just talking about. You can find that at WHAS11.com/vaccine.